Good morning, everyone. On behalf of Asiri Health, I would like to warmly welcome all of you on this occasion of the formal opening of the Asiri AOI Radiation Treatment Center. Let me introduce the members at the head table for all of you. I think on my right, most corner, is Dr. Jagprag Gujral, Chief Executive Officer of American Oncology Institute, South Asia. To his left is Dr. Ajay Bhatnagar, Adjunct Assistant Professor, Radiation Oncology at University of Pittsburgh School of Medicine and Radiation Oncologist at Alliance Cancer Center, Arizona. Next to him sitting is Dr. Manjula Karunaratna, Group CEO of Asiri Health. Next to him is Ashok Patirage, Chairman Managing Director of SoftLogic Holdings. On his left is Dr. Stanley Marks, Chairman and Director for Clinical Services of UPMC Cancer Centers. And then sitting next to him is Mr. Vishal Bal, a Board Director of Asiri Health, as well as the Chairman of Asia Healthcare Holdings, as well as the Chairman of American Oncology Institute. Over to you, Dr. Manjula.
So this is a very exciting and important moment for Asiri Group and for the country, I would say, because we have just opened the cancer center officially, and this will be the first fully fledged cancer center in Sri Lanka. I think it's not only for our perspective, it's not only commercially, it is also, I think, for the country and the society. This is a gift from Asiri and our, partners in this joint venture, American Oncology Institute. I also would like to welcome our friends. They have flown from United States just to be here for this very important occasion. Dr. Stan, thank you very much for being here, and you are the colleagues. So this is a very, as I said, very exciting and historic day for Asiri and the Asiri Group. As you know, Asiri is the largest hospital chain in Sri Lanka, and also you may know that we are going to open our Kandy Hospital that would be open for public most probably by February. So as a group, we have done many first things for this country in terms of medical care to everything. So we are planning to continue this journey. It's not only, as I said, not only from a commercial perspective, we feel really proud and happy to introduce these kind of technologies and centers, although the investments are very high. We know on the long run, as a group, that we will get our returns. At the same time, it is a great moment for us to contribute something to the society. So I would like to invite Dr. Vishal. He's also director of Asiri from TPG, our partners. Let him, Vishal can elaborate more on the technology side of it.
Sure. So good morning, everybody, and it's a pleasure for all of us to be present here today. As Ashok said, that this is definitely a historic moment for the country, particularly when you look at the rising incidence of cancer, which is currently in Sri Lanka, and not just in Sri Lanka, but we have a massive increase of cancer cases, which is happening in the whole of South Asia, and therefore this needs to be addressed. It can be addressed in 2 or 3 different areas and 2 or 3 different technological areas. And that's where the relationship of Asiri with American Oncology Institute comes in. To my right is Dr. Stanley Marks, who is actually the founder of American Oncology Institute, and he's also the chairman of the University of Pittsburgh Medical Center in the United States. Dr. Marks is a renowned medical oncologist in the US and amongst the leading names in medical oncology in the US. One of the visions of American Oncology Institute was to bring US standards of treatment protocols in oncology to Asia. And that is the basic vision with which AOI was started. And as we pursued that vision, more and more, we also realized that one of the biggest issues in cancer care is a protocol-driven, patient-centric approach. And therefore, if one has to pursue precision oncology, which is basically the best treatment for cancer patients, then it is the technology, it is the multi-collaborative approach of clinical sciences, particularly between medical oncologists, radiation oncologists, and surgical oncologists, coming together and putting together the right treatment protocols for them to actually get the best clinical outcomes. So one of the areas that American Oncology Institute is bringing to Asiri in this comprehensive cancer center, which, as Ashok said, is the first comprehensive cancer center in the country, is the entire positioning of treatment protocols and cancer treatment protocols. What we have got in the center now is the most advanced radiation therapy unit in the country, and not just in the country, but in the whole of South Asia. So the TrueBeam STX, which is the radiotherapy equipment that we have put in the cancer center here at Asiri, is the most advanced radiation therapy unit in the whole of South Asia. As a part of that, next what comes is basically how do we transfer protocols and how do we transfer clinical excellence, particularly between the US and Sri Lanka. Because I think what we are trying to do over here is basically bridge the gap which exists in terms of the way that we treat cancer. So University of Pittsburgh Medical Center, which is the anchor for American Oncology Institute and also where Dr. Stan Marks actually practices his medicine, all our treatment protocols over here, which are going to be practiced at the Asiri AOI Cancer Center, will be based on the protocols that are followed at the UPMC Center in the US. UPMC looks at more than 100,000 new cancer patients every year. Apart from that, what UPMC also offers through a network of 250 oncologists is clinical excellence of a very different order. All those protocols are going to be available to the Asiri AOI Cancer Center here in Colombo. The second most important part is the treatment planning. So when it comes to cancer care and when we identify a cancer, which is basically most often than not a tumor, which is causing the irrational growth of cancer cells, that needs to be treated. If that treatment is done with the right treatment protocols, then the chances of us arresting that cancer and the chances of survival of that patient is the highest. So treatment planning becomes a very integral part of good cancer care. What we've got at Asiri AOI is treatment planning which is centralized, which is through a centralized physics and through a centralized structure which is networked, where basically physics or dosimetrists and physicists who are sitting in different parts of the world can actually put together a treatment plan over a cloud. We will be offering at Asiri AOI the treatment plans which are offered to some of the most advanced cancer centers in the region. And all that will be done through our network, which basically means that the patients over here will have access at the Asiri AOI Cancer Center to the cancer treatment planning processes which are practiced by the best oncology centers worldwide. So therefore, when we look at the opportunity that we have over here, the opportunity is not just bringing the best of technology, the opportunity is also to bring the best of clinical excellence, and more than everything else, all this combining together in terms of creating a survival rate for patients which will be much higher and which should be much higher. Cancer, as you know, is a disease which also needs to be detected early. It needs to be diagnosed early. Most often than not, we lose lives to cancer basically because they are not diagnosed in time. And thankfully, Asiri has the entire back-end technology. We have the only PET scan in the country. We have a gamma camera. We have all the diagnostic equipments at the back end, which other providers do not have in the country, which effectively makes our cancer center that much more comprehensive. So we diagnose early, we treat early, We basically bring in the best of US protocols through connections with University of Pittsburgh Medical Center, and hopefully that translates into the best clinical setting that we can create for cancer patients in this country. So we are very proud of bringing all this together. We are very proud of the fact that Asiri continues down the journey of actually bringing the most advanced care through clinical sciences, through technology, through processes, through diagnostics, and presents that to the patient as the most advanced form of cancer care in the region. So I think we today believe that with the Asiri AOI Cancer Center, Sri Lanka has gone many notches up in the way that it can treat cancer for the rising number of cancer patients within the country. Thank you very much.
Are there any questions you would like to take, if you have any questions?
Yeah, so I think that's a good clue, Samanthi, and I did not put that up, and I think Ajay can take it forward from there. The treatment of cancer, one of the other areas in the treatment of cancer is a tumor board. The tumor board actually puts together all the science and all the expertise in terms of reviewing cases and providing a guidance in terms of how the patient needs to be treated. So when a patient is identified as a cancer patient, the clinician who is treating the patient would actually put the patient's records to the tumor board for the tumor board to sit together and assess what is the right protocol with which this patient should be treated. We at American Oncology Institute actually have the most advanced international tumor board in terms of the expertise that sits on the tumor board. Dr. Stan Marks here is the chair of the tumor board. So he and his colleagues every week sit and review all the cases that come to the tumor board and provide the guidance with which that patient should be treated. This facility is actually not available to any cancer provider in the whole of South Asia. In fact, even when we look at other countries like Singapore around us and even down, as you go down to Australia and some of the other countries, the quality of the tumor board and the clinical excellence of the tumor board, the experience of the tumor board that we have at Asiri AOI is unmatchable. And the entire tumor board is comprised of clinicians along with Dr. Stan Marks, who have all been practicing oncology. There are radiation oncologists on the tumor board, there are medical oncologists on the tumor board, and there are surgical oncologists on the tumor board. And all the clinicians who are there on the tumor board have actually practiced and currently continue to practice oncology at the University of Pittsburgh Medical Center. So that is a big distinction, again, in terms of bringing competence from the US to all our patients over here, along with all the expertise of our local clinicians over here. So this can become a very collaborative approach to actually provide the best treatment options to patients. Ajay, you can take it forward from here.
As we know, cancer is complex, multifaceted. And so our approach has to also be that way. So each physician, as a surgical oncologist, medical oncologist, radiation oncologist, have their own unique perspective on how to treat cancers, the different types of cancers. And what has been shown and proven is that the best outcomes are when these physicians come together to decide the best protocol, algorithm, treatment sequence for these particular patients in a prospective manner. And that has shown to have much superior outcomes because as we also know, each doctor also has their own biases and their own unique perspective, and therefore by having everyone together to decide what is best for this patient and bring each unique perspective to understand. It actually becomes a learning process for even us. Everyone life is a learning process. So having these tumor boards that we've been participating in actually has even been interesting for us as the moderators of these tumor boards, learning the unique perspectives of the unique malignancies unique to South Asia that not necessarily are seen commonly in the United States. So it has been a unique and a very rewarding process mutually on both sides, as the physicians that have been at the AOI facilities consulting with us, as well as on our perspective to gain a greater appreciation, understanding of the malignancies unique to South Asia, as well as the unique situations. I mean, medicine is still an art, and it's not just a science. And so understanding the unique perspectives of the cultural, socioeconomic differences here in South Asia, we put all these things together to decide the best treatment for these patients. And it's a collaborative approach, not just from our perspective of the UPMC physicians, but working together with the AOI physicians. It's been quite rewarding, and we all believe that this does lead to the best outcome for the patients at AOI. So we're looking forward to working with AOI, Asiri AOI, participating in these tumor boards.
Stan.
Yes, so I just wanted to expand a little bit on what Dr. Batnakar just said. Certainly, the treatment of cancer has become extremely complex. As we get more and more treatments, new agents, the decision-making has become much harder. So, for example, there are 10 drugs available now to treat kidney cancer. If you go back 10 years ago, there weren't any. And so what we do at our tumor boards is we actually have access to the thought leaders in those disease sites. So it's not just myself or Ajay that are involved in the tumor board, but if there's a difficult case, whether it's a breast cancer, a brain tumor, or a sarcoma, we have access to the experts in those disease sites. So these cases are taken to them before the tumor board for their opinion. And again, it just dramatically improves the recommendations for those particular patients. We have pediatric oncologists who participate in our tumor boards. When necessary, we'll have a neurosurgeon, an orthopod for an orthopedic kind of cancer. But to have those services available for the tumor board is, well, I'm not aware that it happens anywhere. The other thing I wanted to point out is when cancer is first diagnosed, typically a biopsy is done, and a diagnosis is rendered by a pathologist. And the pathology is getting more and more complex, and there are now pathologists who, for example, only look at breast cancers or gynecologic cancers, or they only look at blood cancers. And so again, the pathology is so critical, because if the pathology is erroneous or misinterpreted, the treatment decisions won't be accurate. And so again, we have access to our UPMC pathologists to review any difficult cases, to perform special studies, whether it's genomics, molecular testing. There's a whole array of new tests that are available now to clarify not just what kind of cancer is, but what type of targeted treatment might work for that particular patient with that particular type of cancer. So things have changed dramatically, especially with this new paradigm shift where we're using immunotherapy to treat cancers, oftentimes in combination with radiation. And so it turns out that at UPMC, immunotherapy is one of our major areas of focus. And as you probably know, that's now where many new cancer treatments are being directed, is to using our own immune system. So again, we call on our immunology experts for difficult cases, for example, a melanoma, where we know immunotherapy is the optimal treatment, but how to treat that patient. We have 7 physicians that only treat melanoma. That's all they do. Just to give you some idea about the scope and size of the expertise that we have available for these cases that are presented at the tumor board.
Thanks, Dan. Any other questions? Yeah. Any clarification anybody has? If not a question, have you, out of what we've explained, is there anything that we can clarify more?
Yeah. Sorry? On cancer or? Yeah, and also, other than the surgical, medical, and radiation oncology, my standard treatments for cancer, I think Asiri group is the only group that is using bone marrow transplants as well for certain types of blood and bone marrow malignancies. So we have to, I think, that is one aspect that we will need to encourage and grow more. Anything else, Shama? On
Basically, we consider the cancer treatment, that promotion, prevention, treatment, and the other one is which is very new to this country is palliative. So Asiri Health is focusing on all these aspects, and even the policy of palliative thing very recently come to the government policy. So with that, we have incorporated all these aspects when we consider about patients, not only treatment, promotion, prevention, treatment, as well as palliative. So the whole spectrum is available.
Shama, you like to tell a little bit about palliative care?
Yeah, we give,
Briefly, yeah.
Now, palliative care is a new thing for third world countries, developing countries. So even most of the clinicians are unaware of those things. In developed world, palliative care is well established. So it is needed for many patients. For example, our population also growing population. So our life expectancy is high now. Even a female has 79 years and a male has 72 years. So they tend to get many chronic diseases. One of them is cancer. So most of the cancer patients, in addition to disease-directed treatment, that is chemotherapy, surgery, immunotherapy, radiotherapy, we need palliative treatment also. So end-of-life care, terminal care. So sometimes we need to give disease-directed treatment also somewhere just before these treatments. So all these spectrum is available in Asiri Health. So we have started it and we have managed many patients, and the outcome is very excellent. So outcome in the sense, now when a patient, even at the last stage, if you treat well, the family members give the acknowledgement. So we have got many of these things. So it is a new thing in the country because we are developing in palliative care, but Asiri is having a very high standard of palliative care. So any questions, if I can answer it.
Is it a one-time treatment or to be done routinely?
No, in cancer, it's a chronic disease. Because earlier, of course, cancer is not a curable disease, maybe before 1940s, when the before radiotherapy era, only surgery was available. So we have no way of dealing with local control other than surgery. But after 1970s, the chemotherapy came. So after that, microscopic disease could be handled very well. So the immunotherapy and targeted therapy came in 80s. So with that, a lot of people live with the disease for many years, even 10 years, 20 years, even more than that. So it's a chronic disease. Therefore, the treatment and the help is needed throughout the life. So depending on their requirements. So a country should be available, should be able to provide those services. So I think Asiri is one of the biggest group of centers which can provide this to Sri Lankan population, and not even in not only in Sri Lankan population. We are hoping to expand it around nearby countries also. That we have some plans.
So cancer is a multi-modality treatment, right? It requires a collaborative approach. It is likely that a patient who's been diagnosed with cancer will go through 2 or 3 different treatments, which is either they will go through a medical treatment through medical oncology, they will go through a radiation treatment through radiation oncology, and if required, if the tumor has to be operated, then they will go through a surgical treatment. So the different treatment options in cancer keep shifting as the patient's cancer is treated over a period of time. So cancer is a multi-modality treatment, and therefore, a comprehensive center at Asiri is the one which can really offer a multi-modality approach rather than just one approach in cancer care.
What are the developments in the field of cancer? What are the developments in the field of cancer?
Developments in the field of cancer? I think Dr. Stan Marks is probably the right person to answer that.
So the newest developments are in this area of immunotherapy, which is basically using your own immune system to fight the cancer. We know that one of the reasons people get cancer is because your immune system fails. What are called your T cells can no longer battle cancer. That's why aging is the #1 risk factor for cancer. As we get older, we have a greater risk because our immune system starts to fail. So there's literally been an explosion in discovering new agents that turn on our immune system to fight the cancer. So there are what are called PD-1 inhibitors that basically take the brakes off blocking your immune system so you can fight. There are what are called CAR T cells, there are TIL cells, there are monoclonal antibodies. So we're trying to get away from using chemotherapy, for example, that has so many side effects. And for a lot of cancers now, we can use either immunotherapy or a targeted agent that just kills the cancer cell and doesn't damage the normal cells. And so there's been a huge shift. Now, we still have to use chemotherapy for certain types of cancer, but for many, now patients can be treated with a pill. There are certain types of leukemia that we can actually cure with a pill that has virtually no side effects. The nice thing about immunotherapy, these new agents, is they have very few side effects. Patients don't lose hair, they don't get sick, their blood counts and bone marrow aren't compromised. There's a small risk of what's called autoimmune disease, but for the most part, these treatments are tolerated incredibly well, and they work far better than chemotherapy for a lot of cancers. So that's really where all the excitement is right now. In fact, last month, the Nobel Prize in Medicine was given to a Dr. Allison who discovered one of the forms of immunotherapy.
I think this raises a very important question also, a hidden question, which is that how is Asiri Health and the American Oncology Institute going to make these advancements accessible to the population of this part of the region? And in layman terms, what Dr. Stan was trying to say also is that the science of oncology is dynamic in nature, which is with high incidence domains of medicine, and where a lot of research and innovation is happening. The way you deliver medicine is an ever-changing concept. So it moves from theoretical medicine to experience-based medicine to evidence-based medicine and now to algorithm-based medicine. This is what Asiri Health entails through American Oncology Institute to offer to the population of this region, which is getting the best evidence-based medicine through its collaboration with UPMC, getting the best algorithm-based medicine, which is our central treatment planning through our collaboration and our central treatment protocols administered through the US. So I'll just rephrase and emphasize on your question that these changes and these developments in medicine are now going to be available to the population of this part of this region through this initiative of Asiri Health.
think that brings us to the end of the discussion today. And before we complete the press conference, let me just sum up what we discussed in Sinhala for the benefit of whoever who wants to take a note of it. අද මම හිතන්නේ අපි මේ සාකච්ඡාවේදී සඳහන් කරන්න මූලිකම අදහස උනේ ආසිරි ශල්‍ය රෝහලත් ඇමරිකානු පිළිකා ප්‍රතිකාර ආයතනයත් එකතුව අද ශ්‍රී ලංකාවේ ජනතාවට පිළිකා ප්‍රතිකාර විකිරණ ප්‍රතිකාර සඳහා මධ්‍යස්ථානයක් විවෘත කරා. මේන් එක විශේෂ කරුණක් වන්නේ අපි අද දින මේ නිසා අපේ රටේ ජනතාවට විකිරණ ප්‍රතිකාරවලට ඊටාම ඉහළ තාක්ෂණයක් ඇති variant true beam STX කියන යන්ත්‍රය මෙහෙට ගෙනල්ලා තියෙනවා. එමගින් ලෝකයේ ඉහළම පිළිකා ප්‍රතිකාර මධ්‍යස්ථානවල ලබා ගන්නා තත්වයේ ප්‍රතිකාරයක් අපේ රටේ ජනතාවට ලබා ගන්නට හැකියාව ලැබෙනවා. තාක්ෂණය පමණක් නෙවෙයි අපි ගෙනෙන්නේ. ඒ තාක්ෂණයත් සමග ඔබට ඇහෙන්නට ඇති කීපවරක් කිව්වා ඉන්ටර්නැෂනල් ටියුමර් බෝඩ් කියලා. ටියුමර් කියලා කිව්වම අපි සිංහලෙන් කියන්නේ ගෙඩියක්, එහෙම නැතිනම් පිළිකාවක්. ඊට සංකීර්ණ පිළිකාවක් තියෙන කෙනෙක්ට අපේ රටේ ඊට දක්ෂ වෛද්‍යවරු ඉන්නවා. ඒ වෛද්‍යවරුන්ට ඔවුන්ගේ ප්‍රතිකාර ක්‍රම වඩා සාර්ථක කරගන්නට ලෝකයේ ඇමරිකානු පිළිකා ආයතනය, ඉන්දියාවේ පිළිකා ආයතන තියෙනවා ඇමරිකානු පිළිකා ආයතනයට අනුබද්ධිත. ඒ වෛද්‍යවරුන්ට වෛද්‍ය වාර්තා හුවමාරු කරගෙන සාකච්ඡා කරලා අපේ රෝගියාට වඩාත් උචිතම වඩාත් ගැළපෙන නවීනතම ප්‍රතිකාර ලබා දෙන්නට හැකියාව මෙමගින් අපි ලබා දෙනවා. එයින් අදහස් වන්නේ එකක් තමයි අපේ රටෙන් එළියට පය තියන්නේ නැතුව අන්තර්ජාතිකව ලැබෙන මට්ටමේ ප්‍රතිකාරයක් අපේ රටේදීම ලබා ගන්නට හැකියාව ලැබෙනවා කියන එක. මම හිතනවා ඔබ ඒ පණිවිඩය ජනතාවට ගෙනිච්චොත් ඒක තමයි අපේ පරමාර්ථය වෙන්නේ. ඒ වගේම මේ ප්‍රතිකාරයට යන මිල අපි බොහොම ලෙඩෙකුට දරන්නට පුළුවන් මට්ටමට වගකීමකින් යුතුව ඒ මිල නියම කරලා තියෙනවා. ඊට අවශ්‍ය වුන්ට පහසුකම් අපි ලබා ගන්නට පුළුවන් විදියට සාකච්ඡා කටයුතු ඇති කරලා තියෙනවා. ඊට අමතරව මම හිතන්නේ විශාල් සඳහන් කරා ක්ලවුඩ් ප්ලැට්ෆෝම් එකක් ගැන. එයින් අදහස් වන්නේ වෛද්‍යවරයෙකුට කායිකව අපේ මධ්‍යස්ථානයේටම එන්නේ නැතිව පිටත ඉඳන් තමන්ගේ රෝගියාගේ ප්‍රතිකාර ක්‍රමය මොනිටර් කරන්නට පුළුවන්. ඒට සහභාගී වන්නට පුළුවන්. යාපනයේ හෝ මාතර හිටියත් ඔබේ වෛද්‍යවරයා රෝගියා මෙහි ඉන්නවා නම් ඔහුට කරන ප්‍රතිකාරය ඉතා සාර්ථකව කෙරෙන බවට ඔහුට වගකීමකින් යුතුව බලා ගන්නට පුළුවන්. ඉතින් එවැනි පිළිකා ප්‍රතිකාර මධ්‍යස්ථානයක් ලංකාවේ තියෙන එකම මධ්‍යස්ථානය වන්නේ ආසිරි ශල්‍ය රෝහලයි. එමගින් අපි මෙතෙක් කල් පවත්වනු රෝග විනිශ්චය, රෝග ප්‍රතිකාර, වෛද්‍ය ප්‍රතිකාර මගින් අපි කියනවා කීමෝതെරපි, ශල්‍ය ප්‍රතිකාර වගේම විකිරණ ප්‍රතිකාර. අවසානයේ ડોક્ટર ශාමා ගුණතිලක සඳහන් කරේ සුව කරන්නට බැරි පිළිකා රෝගියෙක් නම් ඔහුගේ අවසාන කාලය ජීවිතේ බොහොම හොඳින් ගත කරලා හොඳ මරණයක් ඇතිවීමට ලැබිය යුතු පහසුකම් හා සේවාත් රෝහලෙන් පවත්වනවා කියලා. ඉතින් එමගින් අපි හිතනවා පිළිකා රෝග ප්‍රතිකාර කරන්නට අපිට පුළුවන් සියලුම ශාස්ත්‍රයේ අවශ්‍ය දේ අපේ වහල යට තියෙනවා කියන එකයි. සහභාගී වුණ ඔබ සියලු දෙනාට ස්තුතියි. Thank you very much for all of you. Thank you for the members at the head table.